Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Whenever we are with her, we get deep into the mind, how it works, what we're thinking about, what others are dealing with. Today, we're gonna talk about bipolar depression and how it affects many. Maybe it's somebody you know, maybe somebody you suspect may be bipolar. What does that mean? How do we deal with that? How do you get some help for that? She's a not only psychologist, she does hypnotherapy. She's an author of many great books, a speaker, and helps a lot of people from individuals, families, couples, and all of that. Anne Creekmore is back with us. Welcome. How you doing?
Good, Steve. How are you?
Very well, very well. Let's go right to the definition of bipolar. We have some thoughts of what it might be, but exactly what is it?
Well, it's a form of depression that used to be called manic depression. It's different from a unipolar depression. That's one pole, like just staying depressed and flat and no energy and depressed or crying spells and things. And the bipolar depression is the old term, the manic depression. You kind of cycle from being depressed to being manic or agitated depression. And so it's still depression. And I like to really emphasize that it's still a depression at its core. It's a person that's kind of low, and not in a positive mood, but has learned how to release their own euphoric inner cocktail of neurotransmitters, their serotonin, dopamine, norepinephrine, and so on. They can do it by spying something shiny and putting their running shoes on, starting to chase it. And then all of a sudden they're able to, they don't have to go to a bar. They're able to just release these neurotransmitters and get a high and get kind of agitated, get manic. And
Well, I never knew that bipolar is also manic depression. Never knew that. And I've heard that term many times over years. Is bipolar the same when we say the words split personality? Is that kind of the same thing?
No, split personality really is originally Bleuler, when they were, having what I guess they call their asylums, back, a couple centuries back, that was really what has emerged to be called schizophrenia. But technically, Bleuler, the psychiatrist and the forerunner there, was actually talking about dissociative identity disorder, was splitting like when you're a child and you get complex PTSD because you don't have anyone to help you, or you're under chronic stress from abuse or severe neglect, and then you use a defense mechanism like dissociation to mentally withdraw, self-hypnotize, and kind of have yourself in different parts of your brain, like you go away and part handles your trauma, because memories are held in different parts of the brain, not just the hippocampus. And so that you wind up, learning how to handle stress, not with projection, not with blaming somebody, but with dissociating, mentally going away and kind of letting another part of your brain take on that role or that job. Well, you start school dissociative and maybe you got to mentally go away. It's stressful, and you get yourself a student part that comes out when things in the environment seem like that. So that's more splitting of the personality. I used to like the movie kind of Split. Wasn't that the name of the movie, Split? Did you see that one? I don't know.
I'm trying to remember that movie, who was in that. It'll come to me. But the point
is they get confused, or like you're saying, it's kind of confusing because people do seem like they're split. Like they're one. They're they're really happy and up, and then sometimes they're down, and in between, there's a bipolar 1 and bipolar 2. Bipolar 2 can cycle through the day. It's supposedly a milder version. You can function better in family and work, but you're really cycling up and down, and to some anxiety, or then some euphoria, or then maybe back to depression, and over the course of the days, not just episodes of days at a time or weeks at a time of a certain level.
So
So they kind of all look alike until you go get it assessed. You kind of can look similar.
how do you know from your standpoint if somebody is bipolar?
Well, I do. I mean, I think the best thing to do is to just ask them, what symptoms they're having. And we use the Diagnostic and Statistical Manual of Mental Disorders, and you go through the criteria to see if, because, everything inside is invisible. We have to listen to the client and they have to tell us and report what's bothering them and do they have this symptom. So just to go through it and see if they meet the criteria for bipolar disorder, they call it in there. And it only takes supposedly like one real manic episode to even get a bipolar 1. You don't have to be constantly, cycling through it over the year. So you go get an assessment and use the criteria. Mm-hmm.
I've heard that people who are bipolar can do some radical things, like make major purchase out of nowhere. Yeah, we're going to go buy a pool. Yeah,
exactly.
Why is that?
Well, that's because that they're basically depressed, right? But they've learned how to pull themselves out of depression, get their euphoric cocktail going by buying something, chasing something shiny. Things that they do are like over shopping, or even some at a far level might be just shoplifting, just wanting to grab things and shop. And poor financial decisions, you just want to do something. Sexual indiscretions, just at things that aren't going to work out well. It's not a well thought out plan. But it's something that at the moment is helping them. They can, overwork too. They don't sleep. They can go through phases where they can go for 3 or 4, hours of sleep and then get up and be on the go, keeping their, high or manic agitation going because they're not depressed that way.
The word manic just came back in. So I guess that's why that used to be called a form of manic depression.
Yeah.
How do you work with somebody? Medication, I'm sure, can be impactful, right?
Right. Absolutely. It's important. Mm-hmm.
What type of medications would people who deal with bipolar situations have?
Oh, they take things like they take a whole variety of things. I don't want to say one and then that don't give credit to another company. But one that comes to my mind that seems to help a lot of people with their irritable outbursts is Lamictal or lamotrigine, and that's kind of got a little bit of concern because if you get a very bad rash, it's a syndrome called Stevens-Johnson. So if you get that, you start taking it, and you don't want to keep taking it because it would have, a negative effect. But that one, gets a lot of families in that are just so grateful when they get on that particular one because it really reduces their irritable outbursts, and the conflicts that they're having. So there's a variety of the mood stabilizing atypical antidepressants, different from your basic one that you get from the PCP generally for depression. I can name those off my head and remember them: Lexapro, Prozac, Paxil, Luvox, Prozac, all the ones that have, and then the generics. Those are not recommended for bipolar because remember, the whole thing is this person has this almost addictive lifestyle of being able to pull themselves out of a depression kind of narcissistically, if you will, by just honing in on what's going to make them happy at that moment and bring them out of it, which isn't necessarily going to, be a happy thing for somebody else, but it's bringing them out of it. And if you just take a little antidepressant to increase your serotonin, which is what those other ones I just mentioned do, then you're just doing similarly. And you're just bringing yourself up again. You really want the ones they give are the mood stabilizer antidepressants, atypical ones that have a mood stabilizer, or they pair it with a antidepressant like Wellbutrin with a lithium or with a Abilify or some mood stabilizer that keeps you from going. You got up, so you're kind of positive mood, but you don't go so far up. It keeps you kind of in the middle. And so there's a difference in the approach, and it does worry me sometimes because people will come in and they'll have on their intake, they're presenting complaint, anxiety, depression, and then when you go through and you ask them, and go through the criteria, it's really not anxiety and depression. It's really the bipolar type depression. And of course, at times you're going to have agitation that will be experienced as anxiety or as being up. Like if you're not overspending and oversexing and overdoing, maybe it's like, well, you're stuck there with this agitated feeling, and that feels like anxiety or a panic attack, but it may not necessarily be really anxiety. It may just be this manic depression or the bipolar depression.
And when we call it bipolar, is it because of the swings? So
yes,
is it that
yes.
Now you're manic depressive, you're on the downside, but it may swing over to the plus side where I'm feeling great. I just bought a Maserati that I couldn't afford, and
exactly,
and all of that. And is that
racing down the street in it?
Right? I'm going to pick up some woman on the side and whatever. Is that really what the bipolar, the swings are?
Yes, that's what it is. They're just swinging from the depression into the mania to pull themselves out of the depression. And without any, they could be reckless, like you're, presenting in that example. Again, it's just reckless, no thought behind it. Somebody once told me that the bipolar mind there is almost like, at the post office, they have these different little slots for different types of mail. And that with communicating with someone with the bipolar, a lot of times is just like, they just pull something out of that slot and throw it down. That's the answer. They don't really want to take the time to communicate and tediously share their mind and then listen carefully and then come to win-win. They just want to go, well, this happened because of this and we're done, and they want to move on. They want to be on the go. They're trying to get themselves out of depression.
Does when we look at all of that with that depression, do people know that they're bipolar? Do they realize that something's a little bit off with my personality, that I'm going from here, now I'm going over here? And does narcissism come into play with somebody who is bipolar?
Yeah, two questions. So the first one is, when you talk to people that, as a therapist, they come in to try to get help and figure out what their problems are. And a lot of people, when they come in, have questioned it. They can't definitively diagnose themselves, and they don't pick up their mental disorder manual criteria, but they kind of know a lot of times that they have it. And certainly when you ask them these questions, say, well, you just met all the criteria, they don't know exactly what you're asking. There's no need for that affecting their, answers. Then they go, yeah, it really does fit for me. So they'll get it. They'll understand it. It seems usually.
Narcissism coming into play?
Yes. Well, the idea of narcissism is that, some people, they're thought to have a small percent population to have a developmental narcissism, where they just didn't, they felt that they realized maybe one of their parents or someone was narcissistic and they weren't there for them. So they kind of develop the splitting where they develop a grandiose self to always look good all the time, and they're kind of an addict to their own getting attention and admiration. That's their whole goal, is to just get somebody to say they're great, and then move on to the next place they can get that. But that's like a personality developmental narcissism. But anybody who is an addict is supposedly narcissistic. And if you have a bipolar addictive lifestyle, well, then that doesn't mean you're at heart a narcissist, but because of the chemical, ongoings that are the ups and downs and your need to try to shoot yourself up all the time inside your head to feel better, then it makes you narcissistic because you're not taking the time to talk to somebody and work something out. You're just trying to find a fix that will make you feel better. So most people. Mm-hmm.
Does addiction come into play with that as well?
Mm-hmm. Mm-hmm. And you have to think that when you put them all together, say, you got somebody that has the dissociative disorder, and then you got a bipolar disorder, and then you got substance abuse on top of it. You got somebody who's really narcissistic, right? And
Mm.
because with the dissociative disorder, the narcissist, they develop a part to stand up for them, because everybody has to have a part to stand up for you. So you have to stand up without, they're like, going down the racetrack, the horses racing, on a certain path, and that part comes out. That doesn't make them all narcissistic. It means just a part of them is going to do its job at times. And then you got the bipolar trying to get that, in a manic state, they're being narcissistic. And then you add substance abuse on top of that, and you got somebody who's probably regularly narcissistic. Not saying that all people who are addicts or substance abuse are narcissists at heart. When, if they start, and that's the thing that I'm into, is like, if people could start to, be able to identify these things, and they kind of do have a clue and come in with it, and then get the right help, the right diagnoses, and so on, and get the right treatments, then they don't have to be, and not acting narcissistically. And we don't have to have this much negativity in the world that we're having. I think when you look at a lot of the people that have done crimes, different things, I mean, they've got something. We know that. We have to ask the right questions.
Mm.
Mm-hmm.
I believe I heard you say a few moments ago, Anne, that bipolar and or narcissism can run in our family. Did I hear that right?
Correct. Yes. I mean, for a variety of reasons. Bipolar, I think the statistic is that if there's a parent has it, that maybe there's a 30% chance a child will get it, or one of the children is going to have it. Is this kind of inherited chemical imbalance of the brain neurotransmitters. And but you have to think too that if a person has something and they have children, that their childhood is not going to be as easy, and it's going to affect them. Because and they may develop it, they may feel loss, that their parent, who maybe they have a bipolar parent, that isn't really available to them, because they're busy trying to get themselves out of depression by, all the things you mentioned. And so then that creates an actual depression of loss or feeling of abandonment, that the parent's not there. Plus, then they have this genetic component that, for chemical imbalance, and it all adds up. Kind of like, in our, with diabetes too, it's like you may have a genetic predisposition, but if you really ate healthily, or you start eating healthily, maybe you can be okay. But if you eat a lot of toxic things that feed into the problem, you'll have diabetes type 2.
Yeah, I never thought of it in that way, that if your parent is bipolar, you grew up knowing that, you probably had some challenges growing up because your parent was over here, swings over here, back and forth. So you were caught in the storm, so to speak. And it's not, the parent's fault. It just is what it is.
Right.
But that can also shape you and your subconscious and how you deal with things later in life. You may not be bipolar, but you dealt with a lot of things growing up. And as we've talked before, a lot of these things that we deal with when we're younger is stuck in our subconscious. That's the programming we keep repeating, and sometimes it doesn't support us.
Exactly right. We can develop like a complex PTSD, just from chronically having to, to deal with someone who's having a parent that isn't able to be there and is maybe acting out abusively, with maybe even with bipolar 1, some physical aggression can be involved. In a manic state, and so they're not getting help. So then they may be physically abused, or at least verbally, emotionally abused, and that, of course, is going to affect them, like you're saying.
How old is somebody, in your experience, the oldest person that's been diagnosed with bipolar depression?
I'm sorry, I don't understand the question.
The oldest person that you've heard of being diagnosed, so people,
Oh, I see, like
later
like
in life, yeah.
Because they're saying now, back when I was in graduate school, they called it manic depression. They said you didn't get it till middle age.
Okay.
Because it didn't look bad. Because if you got manic depression, you're able to work and be with a family and run around sometimes when you're in manic states. And so and then it really adds up. When you're by middle age, though, you've messed up enough that, you're depressed, more clearly stressed out by things. And so so it used to not be diagnosed until then, but now they know and say, I think it's around 21 that maybe you'll get a peak kind of a manic experience that will start to clue you in. So, yeah, I mean, there are people that have it now that will never be diagnosed, and they're older. And back in the day, they weren't thinking it was, if they're older now, they weren't thinking anything that it was, that's what it was.
Well, it just seems so reasonable the way you present that, and in that, by middle age, you've dealt with it half your life, and it's almost as if the emotional jar started filling up, and probably, maybe
Yeah.
maybe the mistakes or the challenges that you had in life, the way you
Right.
reacted,
Yes.
I went into debt because of that Maserati. I did this because of that.
Right.
I'm dealing with
Right.
that now. I got problems, and then
Right.
wait,
Situational problems that you
right,
created in a
right,
manic state. Right.
yep.
Exactly.
On the
And so finally it'll hit you that something's going on. And that's why they used to find them back then around middle age and say, but now we can catch it early, and
sure.
realize, oh, why not just catch it early and then maybe just take your medication and some therapy to help, manage it so you don't have this tendency to overdo and underdo and up and down. Learn how to have a more balanced lifestyle, learn how to take time to express with people, speak your truth in a healthy way, and work out win-win negotiations and, lead a normal life.
What is the starting point? Let's say somebody feels that they may be bipolar. They're dealing with stuff. Maybe you know somebody who is, maybe somebody in your family,
Right.
maybe it's your partner. What is really the first step here?
Well, probably to get an assessment, find somebody who specializes with bipolar, a therapist, or often a licensed clinical psychologist has got the highest degree, the doctoral level, and more testing training. Other helping professionals don't necessarily do the testing stuff. But so if you can just find someone in your area that you can go and get an assessment for that. And usually and there are specialists that just therapists that specialize in it and do the
Really?
assessments.
Okay. All right. Well, I wasn't aware of
Yeah.
that. Huh.
Yes.
Huh.
Mhm.
And would you say, and again, this is not scientific, but I'm just kind of curious, what your feel is.
Uh-huh.
Uh, People who are diagnosed to be bipolar, what do you think is the percentage of people that go on medication? Are we talking like, well, typically about 80% of them do, or, and again, not scientific, but your vibe, your feel.
Well, yeah, that's a hard question because are you saying that if they're told that they have bipolar and told to take medication, what percent would take it? Or are you saying
How
what?
wind up on what wind up on? Joe is diagnosed to be bipolar. You got all the signs. Yeah, you're dealing with it. Yeah. How often would somebody like Joe be put on medication? Typically, is it the main treatment route? Of course, therapy and all of that. But is it a challenge that people go through where typically, yeah, medication is suggested?
Yes, yes, that would be generally suggested. I
Okay.
know the integrative psychiatrist will sometimes recommend taking lithium orotate, which is the mineral lithium, and you can just get it from Amazon like everything else these days, and
Oh,
take a couple of those because supposedly the reason that the chemical imbalance occurs is that there's not enough lithium in the
wow.
system, like you don't absorb it enough, or your body doesn't take it in properly, or whatever. And in fact, they've actually done studies, I think, where they've compared the water supply in some counties with another where there's high lithium in the water supply, because it's a normal thing you eat and you drink and bring in lithium, the mineral. And they found that the ones where it's lower lithium in the water supply is a higher crime rate than the ones where the aggressive crime rate. I mean,
Wow.
So it's but I think generally, if someone, if a helping professional is treating someone with bipolar, they're going to try to get them with a doctor, psychiatrist to prescribe, and hopefully they'll comply and enjoy the benefits of it.
How interesting. And we're out of time here, but in closing, lithium more important than ever. We talk about it in terms of that. It's also used in batteries. So they're finding there was just a discovery made somewhere in the world of this major lithium deposit. All the Tesla cars and that run on battery. We need lithium. We need lithium to be, better
we need
mentally,
Teslas.
and for Teslas too, and all other batteries. Good talk today. Lots of insight on this.
Thanks, Steve.
And how do we find you? I know you've got a lot of great books. Not Fit for Human Consumption is one book that actually talks about what we're talking about today.
Right, correct.
What's your website?
It's Psychologist in Virginia, all spelled out and plural. Psychologist is my main website, and I think you can find pretty much my emails and phone numbers and everything right on there.
Terrific. Great talking with you. Anybody that's going through some challenges, or maybe you need to learn more about it, maybe for somebody that absolutely reach out to Ann. Great having you on here. Really appreciate it.
Yeah, appreciate you. Thank you.
Thanks. We'll be right back.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.